Welcome to the PT channel. This video will talk about surgery, when you should have it and when you shouldn't have it, and just some general education about it. Now, we got some emails from people here about surgery, when they should have it, if they're asking about themselves and loved ones and everything too. Now, the general consensus for myself and a lot of us are that surgery should be a last resort. Surgery should not be anything to improve something when you're doing pretty well in a lot of different aspects of life, or athletics, or ADLs, activities of daily living, or some form that you're okay with everything in your day-to-day activities. Now, surgery is for main things of really a traumatic event. Now, the big example is ACL surgery. If you're a sports fan, or you know anything about sports, or you know anything about just general injuries, the ACL is a common knee ligament that is torn from athletics. Now, you have to have that repaired if you want to keep playing athletics. Now, some people don't get it repaired because they tore it skiing or playing football or basketball as, you know, outside of work and a fun thing on the weekends or something, and they have a desk job, so they don't need to have that done there. But if you were a professional sports player and you tore it on the field, and you want to get back to doing that activity, you have to have surgery on that. So it's pretty important to have that aspect of surgery needs to get done. Now, that rehab is going to take you months, 10 months to get back on the field, and it's going to be an arduous task. But if someone's investing millions of dollars in you, you want to do it. Or if you're a high school athlete who wants to go to college, potentially play college football or basketball or baseball, whatever the sport may be, they have that option to do it in sports for the future. It's a good way to do that, and then that's the task to do it. Now, rotator cuff, major trauma, anything that really takes away from your quality of life. Total knee replacement for the elderly because they can't walk. Their arthritis is so bad in their knees or their hips or shoulder or anything that they cannot do anything their normal day-to-day tasks, like walking, dressing, cooking, cleaning, carrying anything. Those are the big things that you want to focus on, and that's when you go to do it. You don't go to a doctor and the doctor tells you, okay, I'm going to get an MRI because you're having knee pain, let's say, because this happens numerous amount of times, where a high school athlete goes to the doctor and having some knee pain. They've been doing sports for years. They're 17, 18 years old. And they get an MRI because the doctor's not going to know what's really going on there until they get imaging done. They get an X-ray maybe first that'll show bone fractures or anything major on there. Usually comes back negative unless it's a major traumatic event like a car accident or a collision or an injury or anything there too. But let's say for this case, the patient did not have that. But the patient gets an MRI done. They show the soft tissue better of the knee or the shoulder or whatever it had done. This case will be the knee. She goes in, gets MRIs done on both knees. They show meniscus is torn in both knees. She's only having a problem in one knee. She goes in and the doctor says, oh, you have 2 torn meniscus. I can heal that right up for you. We'll do surgery. We'll get you in next week. You'll be good to go. Okay. So patient goes in, doesn't know any better, has meniscus surgery, doing okay, but the one knee is still bothering her. The one knee is fine, as a torn meniscus as well. That was cleaned up, where they basically shaved the bone down, or shaved the meniscus down and any loose particles in there too. So the meniscus could be flapping up in there and blocking the knee joint from sliding or gliding properly. But meniscus are cartilage. Once you remove them, they do not grow back. So you're born with as much cartilage as you're going to have. So it's important to preserve that and keep that as long as possible. Don't have surgery to remove that. It's not going to grow back. So that doctor probably should not have done surgery on either knee, let alone the one knee, if it was really counterproductive for the patient to do athletics or something that person was going to do. Now, the patient didn't have good outcomes, grin and bear it, pain with activity, pain with muscle activation, could return to sport, but it just wasn't right. So that's a case where the meniscus probably should not have been done because she probably could have done the task in the sport beforehand, but chose to do it. Once you have surgery, there's no going back. Surgery is done, you move on from it, and that's it. It's not always going to be the catch-all, end-all, be-all. So I wait, and I wouldn't have meniscus surgery ever unless I can't bend my knee, squat, sit to stand, walk, run, do any sports. Then I have to go in there because it was blocking my ability to do those things. But I wouldn't have surgery at all And I'm in my 30s, so around that age now where it could start bothering you. Now you want to be able to do those things. If you're limited, then you do it. Then you do it. The last resort, surgery, anything. Rotator cuff, back, knee, ankle, any type of surgery. That's a general guideline for it. Now, if you're having something with the doctor and you don't really agree with them, try therapy first. There's a lot of studies have shown, especially for knee pain or knee injuries or meniscus for sure, that physical therapy has been proven effective for meniscus injuries or tears to do that and prevent surgery from even being done at all. So conservative treatment of therapy, home exercises, taking care of it, unloading the joints by increasing the muscle activation and improving muscle strength, activation, posture, and education can go a long way. So surgery should be your last resort. I can't stress that enough. So please get that into your head. Is surgery is the most important thing to do, and wait because you can't go back from it. So meniscus surgeries, rotator cuff things, you can get away with them if it's not a big tear or it's debilitating enough. So that's just a simple little message of that. Now it makes sense, but you're going to go into the doctor, and the doctor's going to want to get you in for surgery because orthopedic surgeons make money from orthopedic surgeries. Surgeons do surgeries because they make money off of that too. And when it's warranted, that's great. But good doctors will tell you, I would not operate on this yet, or I would wait for it. Great doctors would try therapy first, education, and give you the real deal on there too. They're not going to make money unless they operate on you, but that's counterproductive if it's not best for the patient. We want to make sure that we're giving the right things to patients, whether you're a doctor, physical therapist, any kind of medical person. You want to make sure you're doing the right for your patients. And then sometimes the surgeons just jump right into surgery because they can fix it, and they don't even do anything to help the patient afterwards with providing therapy, but that's a whole other video. But ultimately, listen to your body. Don't rush into anything. Try some therapy, conservative treatment, always first, no matter what the condition is possible, unless it's a debilitating condition. So that was just some surgical guidelines. Please like, share, subscribe, post comments, questions on there too, like some of the things I got here from questions from patients on there too. Hopefully that answered some of the questions. Again, please like, share, subscribe, comment, all that good stuff. And as always, thank you guys.